Subsegmental atelectasis and nonspecific pulmonary fibrosis are both conditions that can appear on a chest X-ray as linear densities, making it difficult to differentiate between them without further investigation. Understanding the differences between these two conditions is crucial for proper diagnosis and treatment. Subsegmental atelectasis. Subsegmental atelectasis refers to the collapse of a small portion of lung tissue, involving less than a whole bronchopulmonary segment. It is often the mildest form of lung atelectasis, meaning it doesn't cause significant changes in lung volume or noticeable clinical symptoms. Causes of subsegmental atelectasis. Airway obstruction, a blockage in a small airway, such as a mucus plug, inflammation, or a small tumor, can prevent air from reaching the alveoli, leading to collapse. Hypoventilation, inadequate breathing, often seen in post-surgical patients. The morbidly obese, or those with abdominal pain, can cause subsegmental atelectasis, particularly linear atelectasis, which is a subtype characterized by linear densities parallel to the diaphragm. Radiographic features. Linear densities. Subsegmental atelectasis often appears as linear densities on chest X-rays, which can be mistaken for fibrosis. Wedge-shaped densities. In some cases, subsegmental atelectasis may present as wedge-shaped densities, especially those caused by airway obstruction. Radial distribution. Subsegmental atelectasis due to airway obstruction typically shows a radial distribution, following the bronchial and bronchiolar tree. Nonspecific pulmonary fibrosis. Nonspecific pulmonary fibrosis is a type of interstitial lung disease (ILD) characterized by scarring and thickening of the lung tissue. This scarring can restrict lung expansion and impair gas exchange, leading to shortness of breath, cough, and other respiratory symptoms. Causes of NSFP. Idiopathic. In many cases, the cause of NSFP is unknown, making it idiopathic. Environmental factors. Exposure to certain environmental triggers, such as dust, chemicals, or smoking, can contribute to an SFP. Other conditions. An SFP can also occur as a complication of other conditions, such as autoimmune diseases or certain medications. Radiographic features. Reticular opacities. An SFP typically presents with reticular opacities on chest X-rays, which are fine, linear densities that resemble a network of lines. Honeycomb pattern. In advanced stages, an SFP can develop a honeycomb pattern, characterized by small, air-filled cysts surrounded by thickened walls. Ground glass opacities. An SFP may also show ground glass opacities, which are hazy areas of increased density. Differentiating subsegmental atelectasis and NSFP. Distinguishing between subsegmental atelectasis and NSFP can be challenging based solely on a chest X-ray. Additional investigations are often necessary for a definitive diagnosis. High-resolution computed tomography. HRCT provides more detailed images of the lung tissue, allowing for better visualization of the patterns of scarring and collapse. This can help differentiate between the linear densities of atelectasis and the reticular opacities of fibrosis. Pulmonary function tests PFTs. PFTs measure lung function, such as lung volume and airflow, which can help assess the extent of lung involvement and differentiate between restrictive and obstructive patterns. Bronchoscopy. Bronchoscopy involves inserting a thin, flexible tube with a camera into the airways to visualize the lining of the bronchi. This can help identify any airway obstructions that may be causing atelectasis. Treatment and management. The treatment and management of subsegmental atelectasis and NSFP vary significantly. Subsegmental atelectasis. Treatment for subsegmental atelectasis typically focuses on addressing the underlying cause. This may involve airway clearance techniques, chest physiotherapy, such as deep breathing exercises, coughing, and postural drainage, can help clear airway obstructions and promote lung expansion. Bronchodilators. Medications that open up the airways can be helpful if airway narrowing is contributing to the atelectasis. Treatment of underlying conditions. Addressing underlying conditions, such as pneumonia or asthma, can help resolve the atelectasis. NSFP. Treatment for NSFP is more complex and aims to slow the progression of the disease and manage symptoms. This may involve medications, anti-inflammatory medications, such as corticosteroids, can help reduce inflammation and slow fibrosis. Oxygen therapy. Oxygen therapy can help improve blood oxygen levels and alleviate shortness of breath. Pulmonary rehabilitation. Pulmonary rehabilitation programs can help improve lung function and exercise tolerance. Lung transplantation. In severe cases, lung transplantation may be considered as a last resort. Conclusion. Subsegmental atelectasis and nonspecific pulmonary fibrosis can both present with similar radiographic findings, making differentiation challenging. A thorough evaluation, including HRCT, PFTS, and potentially bronchoscopy, is necessary for accurate diagnosis. Treatment and management strategies differ significantly between these two conditions, emphasizing the importance of proper identification.